Hi, my name is David Tai, and I'm a medical oncologist practicing in National Cancer Centre, Singapore. Neuroendocrine tumors, or cancers, are tumors that arise from a group of specialized cells called neuroendocrine cells, which exist throughout the body. These neuroendocrine cells share common traits with nerve cells as well as hormone-producing cells. Neuroendocrine tumors is not common. It affects between 5 to 7 out of 100,000 people annually. The cause of neuroendocrine tumors are largely unknown. However, there are certain groups of patients that are at increased risk of developing this condition. Inherited conditions such as multiple endocrine neoplasia 1 are associated with increased risk of development of certain types of neuroendocrine tumors. Neuroendocrine tumors affect females slightly more than males. However, the cause is unknown. Individuals of any age are at risk of developing this condition. However, this condition is rarely seen among children. Importantly, there has never been any environmental nor dietary factors that have been associated with the development of this neuroendocrine tumor. The symptoms for an individual with neuroendocrine tumor consist of the following. Number 1, general symptoms such as tiredness, loss of appetite, or unexplained weight loss. For example, if the tumor resides in the intestines, individuals can experience abdominal distension, change in bowel habits, or nausea and vomiting. And lastly, symptoms pertaining to the secretion of the hormones itself, such as diarrhea, wheezing, and change in skin color. Biopsy is the surest way to diagnose this condition, and that entails doctors removing part of the tumor and examining it under the microscope in the laboratory. Once the diagnosis has been ascertained, a series of investigations will be conducted, firstly, to determine the extent of the tumor, and secondly, whether the tumor produces certain hormones. Computed tomography scan, magnetic resonance imaging, and nuclear medicine imaging are useful for the former, whilst a series of blood and urine investigations are useful for the latter. It is a challenge treating patients with neuroendocrine tumor, firstly, because this is an uncommon condition with non-specific symptoms, and often only apparent when the disease has spread to the various organs. Hence, patients can experience symptoms for prolonged periods of time before actually receiving the diagnosis and hence treatment. Secondly, a group of patients do present with hormonal secretion symptoms that sometimes can be very difficult to manage and requires a multidisciplinary approach. Lastly, there is great inter-individual variability in terms of clinical course, and certainly one size does not fit all.
I'm David Ng. I'm the head of the Department of Nuclear Medicine and Molecular Imaging. I'm a nuclear medicine senior consultant. The treatment options available for NETs patients include surgery, local ablative therapies, radionuclide therapies, chemotherapy, and radiotherapy. Targeted radiotherapy is also called peptide receptor radionuclide therapy, or in short, PRRT. This involves the infusion of a radio-labeled isotope peptide into the body intravenously, and this drug will basically target the tumor in the body. This PRRT treatment is done over a period of 4 to 6 cycles, each cycle being about 2 to 3 months from the previous cycle. And typically the patient is either able to go home the next day or the same day. Neuroendocrine patients are usually managed on a multidisciplinary approach, and nuclear medicine is one important component of this multidisciplinary approach.
Hi, I'm Bill Claxton. I'm president of Carcinoid Neuroendocrine Tumor Society of Singapore. I was the co-founder of this organization, which was established in 2009. Carcinoid Neuroendocrine Tumor Society of Singapore is not a very large group. We have about 100 patients who are members, and also a dozen doctors who are professional members. These patients are not all in Singapore, maybe 10% or so are in Singapore, and the rest are around the Southeast Asia region. And our primary role is education and support for the patients. When we say support, it's consultative. So what we do is we meet with the patients who are newly diagnosed or who are going through restaging of their disease at some point. And they want to know what's the best available diagnostic or the best available treatment at that particular point in time. So in terms of patient education, we've done a lot of video recording and webcasting. Singapore, being a center of excellence in the region, has always had conferences like this one that we're attending today, where the top doctors from around the world will come and present papers. And when that happens, we will try to bring the physician to another setting where our patients can join in. And so we would host an event and record the event, and in most cases we will live webcast the event. And this webcast or webinars reach not only the Southeast Asia region, but worldwide. My message to those who are suffering with this carcinoid or neuroendocrine tumor is that they must approach it with a dispassionate attitude, not emotion, use their scientific mind, or rational mind, to try and find the best way forward. And each patient is a group of one. So in a sense, each patient is going on a personal journey. So the patient has to approach with a positive attitude and all the time trying to learn and get the best solution from what's available and what's in their budget.